with a BTS type, AMG type machine, but much higher level, much higher generation, when every millisecond is measured by cameras, for example, by electrodes, and then we have answer where the stimulus really now, what area, what level of the brain the stimulus is reaching. This will give us next answer, what must be the exercises for us to reach now.
Hey everyone, welcome back. Dr. Sinicropi here from the Society for Brain Mapping and Therapeutics. This is 22nd Annual Neurotech Conference. What's great about this conference is that we find people from all kinds of backgrounds, and that's what makes this conference so interesting. So I have a really special topic. I'm not gonna try to butcher it for you because it's something that's new to me, but I can tell you that they presented their research, their work, and it kind of spread around the entire conference how amazing. So I had to have them on the show, of course. So I am joined by Dr. Masgutova and Isabelle, and I'm so thankful for you to be on the show right now. And we're going to do a little demonstration too, because I think it's demonstrating really shows kind of what they're doing. But before we get into it, you work in the field of reflexes. So I'm very good. Tell us what is the field called, and how are you connected to society? I mean, it is multidisciplinary, but how did you get connected with this group?
Dr. Stefano, first thing, thank you for compliment and thank you for invitation. So now, answering your question, a reflex is automatic response of our central nervous system for specific stimulus. And this specific stimulus must cause proper response. It must be adequate, it must be specific. And this is the area, amazing area, that science, when we talk about neuroscience and research on level of objective tools, let's say with now use of the AI ways, still is nowhere yet. So we hope that in the future, instead of waiting 40 or 70 years, it will come. So now, our work is based on a definition of a reflex, and we're repeating the nature of how trigger or activation of the receptive sensory area or field on our skin, for example. It can be visual stimulation, it can be auditory, but I will show you the example with, let's say, tactile system, okay? The touch of specific area must cause specific response. And reflex is considered after, let's say, 12 months, basically. It must stop its existence. But it is not logical. Nature gave reflexes for protection, for survival. Not only, also for teaching the nerve system, for, let's say, nerve transmission, for neuronal adaptation, for interconnectivity between reflex pathways, also for paving the pathway, myelination, and even neuroplasticity.
That was excellent, because making the connection, so people that are watching this, just like me, they may not, be familiar with this thing. So what is I like what you said. The reflexes are not just there necessarily to be reflexes, but they're training the circuitry of the brain and everything. Like, because when we're re-educating the nervous system, for example, after a concussion or something like that, or a traumatic brain injury, can you use these
Dr.
methods?
Stefano, now you explained as doctor exactly what is happening. So this is why ignoring doesn't mean a possibility for people not to study this topic. It is very much important for recoding when we have children and adults with different challenges in the development, neurodevelopment, learning, but also those that have, that get, for example, a traumatic brain injury. we need to start sometimes life from the beginning. For those who have brain stroke, for example, or why we cannot pause or stop Alzheimer deteriorating features, anything that is happening as a consequence. So let me come now with some interesting things. First, reflex. A reflex is an automatic response. I will ask you to give me your
I'm going to scoot over a little bit here.
Maybe a bit more, okay? So, and I'm going to trigger.
I'm safe. It's okay.
I'm going to trigger now flexors of the forearm. It is 1/3 away from the wrist joint. And the other point will be below 1/3 from the elbow. So I'm just giving pressure. Up, and suddenly you're going with flexion of the palm and fingers. Do you agree?
I agree. I'm feeling it.
And you didn't plan, you didn't program this. You didn't control. So that means it is automatic. Do you agree?
It's automatic.
It is inherent, and
there's nothing I could do about it.
And this is correct response. If I'm pressing at that point, you do not have this response. And here you feel that complete different responses when I'm touching point number 1 and point number 2.
Completely
so
different.
So the correct response is here. I need to know where I go in order to activate flexors, for example, for hands grasp reflex pattern. So I'm pressing there, and you go for flexion, correct response. But sometimes it is not correct. If reflex circuitry is not formed properly, many children that, let's say, get the birth trauma or birth stress, and their circuitry system is not established immediately. So now, please, let's imagine that you are giving me a wrong pattern. Instead of flexion, go for opening of the palm. Hop. What do you feel there?
Tightness.
Tightness. So pressure is increasing. Muscles do not work in their proper way, I would say. So now, too much pressure, it will cause protection, maybe survival response. And now what will happen? Our brain stem will be worried more about what to switch on for protection, whether other reflexes, then compensation will happen, or to switch on maybe parallel protective system such as HPA stress axis. H, hypothalamus, P, pituitary gland, A, adrenals, So, and now, open please, you feel, if we will go even further, not listening to the protection, then we can actually damage our tissues.
Interesting.
So, this is what is happening there. First, my goal was to show what is a reflex and what is happening when reflex doesn't work properly. So what we do in our work, we created reflex assessment screening, and we...
Are mine okay? Am I okay?
You were correct. Yeah,
okay,
you
good.
responded
I'm good.
properly. In one place, it was just overreaction. I think that in the field
you mean
of
the little bit of
your medical practice, sometimes you can be
Well,
frightened.
I mean, to be honest with you, you were getting close to my ulnar nerve, so I was like, she's going to squeeze my ulnar nerve, and my hand's going to go numb. So I was just bracing a little bit. So
okay.
I look forward to seeing that part.
It's not about protection at this moment. It is just like more explanation. So the research for analysis of parameters of reflex patterns, such as whether circuit system works correct or not, because instead of correct, you could go to adduction, abduction, for example, supination, pronation, anything like that. Then it is also direction. For hands grasp, direction is straight ahead. For asymmetric tonic neck, it is turning of the head, and you go with extension of the limbs on the same side of the body and flexion on the other side. So we want to know if direction is correct. Direction correct, that will mean that motor neuron in the circuit works properly. Then we know also that GABA and other inhibitory neurotransmitters are functioning well enough. They are in norm. Then it is about muscle tone regulation, and it is timing and next symmetry. And each parameter has 4 features. 5 times 4 will be 20. So our scoring system is from 0 to 20. We want AI to do all this work, because subjectivity always will be a matter in this case. This is why we're at conference. We want to move our future. We want AI people to come and do this type of work. When we are talking with engineers from AI, sometimes we do not know how to form the technical task.
Of course.
How it would be good, like you are in, whether it will be electrodes or anything like that, whether BTS type, AMG type machine, but much higher level, much higher generation, when every millisecond is measured by cameras, for example, by electrodes, and then we have answer where the stimulus really now, what area, what level of the brain the stimulus is reaching. This will give us next answer. What must be the exercises for us to reach now in rehabilitation, in neuromodulation, in order to save neurodevelopmental time, effort, also financial aspect of that. Yeah.
I mean, I'm just, all the wheels are turning. Again, this is not something that I can, because I can tell you that we take care of a level 1 trauma center. So we have all these TBI patients, we have all the other people, and they have rehab programs, and I could tell them not, and they're not doing this. So they're not doing this. So it's interesting. Like, that's why these conferences are great, because we get to meet very interesting
program, not medically oriented specifically,
right?
But at the same time.
But neither was acupuncture. Neither were these.
After you doctors, the development is there. Do we want to stop it or to continue further on? Because every helping professional, in hope, does do something for our children and adults to develop further on.
That multidisciplinary, action, people have to understand it's not one thing. It's, when it comes to rehab, it's not one thing, because everybody has their one thing. Oh, if you do this, you're going to come back. Oh, you have this injury, you do the one thing. No, it's putting together in a sequence. And how do you do the total body, including spirituality and all these? I'm into all this. I love this stuff. So now I got a new thing that I can talk about, and I got my hand this. So your focus is on the neonatal world and this stuff.
Well, yes, this is one of my specialties. And when it comes to reflex, at the beginning of life, it is when it is the most expressed, because we are in the reactive time. The reflex do not disappear, as Dr. Masgutova mentioned. They follow a dynamic development. But at the beginning of life, with premature baby, even more reactive, and then newborns, the reflex are reactive and extremely expressed. So that's where the intervention can be optimized. We can really recode or activate if it is not, or rewire if it's miswired at that time. And so the whole work once has its value when we do early intervention, but it is not exclusively the work for infants. So I am an infant specialist. I work in the NICU, but we also work in international teams, and we work with all age population regardless. But if that stage from the beginning of life was miswired, we go back to that stage, because we must follow the proper physiological sequence. So we can work with adults. We mentioned TBI, but it is truly applicable for all sorts of neurodevelopmental deficit, including spinal deformity, orthopedic deformity, many different genetic disorders.
Yeah, it's so interesting the way that everything is it's tied together. And we have conferences and we do all this stuff, but so many things are not understood yet. We don't know.
Correct.
This has been going on for, a long time. We have advanced imaging, we have all these things, but yet there's something else. I interviewed a neurosurgeon yesterday, and it's just so interesting and I'm seeing that this pattern is very thick. So people start their careers, and at the beginning, they just do what they do, right? You're a neurosurgeon, you want to know, okay, how do I take out a tumor properly? How do I do a good spine surgery, whatever? I'm an orthopedic spine guy, so you want to make sure that you're very good at what you do. Then you start having other thoughts. Then you start well, this is not the total, thing. So we started getting into all how spirituality and that higher level ties into healing and recovery and all this other. Same thing here. We're just missing so many
Where they see link.
we're just missing those little things, and they're right there in front of us. And in some ways, even though this is a biotech conference, it's some of the more simple things, like, hey, let's look at the reflexes, let's see what that's doing, or hey, let's work on spirituality, or whatever, that can make a massive impact. So just real quick, because now I'm interested, and again, I'm coming from, I know as much as you guys know about this particular subject, but if let's just say you have a neonatal child and they clearly have a reflex problem, do you then try to like hyperstimulate the reflex? Like, what is it, what I want to get at is what is it that you do? Like
so, yes, after we assess, is the reflex present or not, or is it present but not within the 5 parameters Dr. Masgutova mentioned, then she developed manual techniques. We can activate the reflex. If the reflex is hyper or hypo, we will regulate. And in newborns and premature baby, one of the first reflex we look at, it's sucking, swallow, breathe. So you have the breathing reflex, you have the oral motor reflex, you have the vision reflex. So when you work with a 29 weeks old or 36 weeks old infant, you can truly change this within sessions, or activate.
Faster than usually.
It's just interesting because one of my kids was premature, so I know I know my way around the NICU just from my own experience. But so you have a kid. So do you, where you work in the NICU? First of all, you're in Florida? Which NICU?
So it's Boynton Beach Hospital, East Hospital.
Okay, that's a beautiful area.
Level 3.
All right. So when you're in the NICU, do you get like consulted on to see specific kids, or do you evaluate all, like in your capacity? Do you just go around and you're reflexing them up every single day?
An excellent question. We needed to have the referral from the neonatologist, and initially only babies with an established diagnosis would get a referral. But I fought with my team
there we
to
go.
say every single baby should be, because being a premature baby is already a good indication. And then the trauma of being hospitalized, if you look at the course of an infant, a baby that's born and admitted in the NICU versus a baby that's born and goes home with his mother.
Huge difference.
48 hours
Huge
later.
Difference, yeah.
This baby already experienced huge
trauma. It's huge trauma. They're almost like they're that stress response, like being in in an accident or something like that, right? Or huge surgery or something.
Baby in the world should, and one of our goal would be that every baby gets a reflex screen before they go home, as it is for hearing test, for example. Now in US it is mandatory. If we had a chance to conduct those reflex screening,
how many lives would...
So now you are doing more outside of the neonatologist. So are you picking up things that, like, are you picking things up now where the kids seem completely fine and you're like, wait a minute, your reflex is completely off, and saving them than having developmental delays down the road?
Absolutely.
To find red flags.
Red flags.
Immediately at birth, within 10 days.
Instead of waiting, let's take autism. Everybody knows about autism. Usually they don't get diagnosed until age 2 because the child is not showing proper speech development.
All right.
There are
Dr. Masgutova has assessed thousands of children with autism.
With a T, thousands.
And we established a profile.
As you know, autism is a big, it's a big, it's a big, I mean, it's a big buzzword. I mean, autism right now is a very hot topic in America. Everyone's talking about autism a lot. Yes. So let me ask you a question. If you find an abnormal reflex, I don't know if you know the answer to this, but if you find abnormal reflexes in a 10-day-old baby, do you feel like that is a precursor to autism?
Can be.
Red flag. It puts at risks for...
But we don't even have a number. We can't even say, because we haven't done the study, so you can't say, if you have these reflexes, there's a 10% chance that you're going to become autistic.
We did this research. We know exactly how hands grasp is formed in them, how hands pulling reflex is working. There are several more, asymmetric tonic neck, why they are hypersensitive. I mean, because of what reflexes and the immaturity, they can be hypersensitive. I give examples only. So we have our system, we have our profile, reflex integration or reflex development profile for them. What we are coming, that reflexes that are called primitive traditionally, we are challenging very strongly at this moment the specialists that are talking about reflexes. They are in the field of reflexes or reflex integration. They talk about primitive reflexes, primitive reflex integration. We say this is lack of knowledge already, because reflexes are something, phenomenon that is having developmental dynamic very clearly. It is 1860s when Sechenov, next, let's say Dr. Charles Sherrington, were telling that reflexes go through their developmental phases from unconditioned to transitional, and then conditioned. Within that now, we, thanks to our work, practical work with children, come to, let's say, 7 phases differentiation. And we state primitive reflex, it is at birth. First 10 days for some reflexes 28 days or 2 months. Then reflex with its development must next move to a reflex that we call primary reflex, basic reflex. Now, it is not only about protection, survival, and suffering after birth. Baby must adapt to the world. Now it is an environment. Now it is separation of the body from mother's body, terrestrial attraction, everything that child must go now with anti-gravity, let's say, yeah. So this period is finishing, adaptation. Next, the function is added, which is about neurodevelopment further on. This is very different than protection survival, and plus on the top now also neurodevelopmental mechanisms. So child now is learning to some touch for vision activation, auditory activation. Now a baby actually gets into communication with surrounding, getting some learning, some experience. This is not the same reflex. So it is primary reflex. 1934, Vygotsky was talking that reflexes do not disappear. It is very much important to remember about that. Otherwise, it is not safe for protection, for survival, and for our development. So we want to see how the role of reflexes when you are in trauma, being an adult, work or not. So it is very much important that we see this integrity of reflexes in the later ages when it is accident, something unexpected, sudden trauma. They must shoot immediately to save our body, like against of falling down, damaging yourself, for example. Or they must keep silence and to function as neurophysiological support for cognitive functions at school.
I mean,
so it is important.
That's
too
a lot
much
of
information.
No, it's not too much information. No, it's fascinating. I'm soaking this stuff up. No, it's interesting. Unfortunately, my brain works, and then I'm just trying to connect to all these different dots.
Reading, for example.
Yeah.
If child with autism, eyes are locked, tunnel vision, and when they move, they try to move the eyes, then they move with whole head. There is no maturity of eye tracking reflex pattern, and the reflex pattern in this at this moment is more in primitive pattern. So if we are at the center of the body, then protection is ready. Moro, fear paralysis. Sometimes they jump at the same time, different reflexes, and they're not compatible. They must know their place and their sequence, so to say, in the solution of protection and survival, let's say. And here, in this case, how this child will read. So for reading, moving head non-stop.
Instead of
So you understand, protective brains will say, stop reading, this is not important for your survival. Let go, don't learn for this. Or if child has some ability to make eye movement free, that means reflex reached its maturity. It can now give freedom for stereotype repetition, stereotype reaction, for ability to step in an unconscious level, now to move eyes-oriented way from left to right in our cultures, or in other cultures maybe from right to left. This is how Reflex is organizing your physiological foundation for high-level skills.
I mean, it's fascinating the way that it really
Well,
is.
it is
It's
easy to
fascinating.
see.
And obviously, you guys are over the top passionate about it.
We gave our life,
No,
professional life,
but that's
to study all
and
this.
that's what is so exciting about. I love coming to conferences, like especially these multidisciplinary conferences, because the people that are here, this is what you do. This like I just like people just want to get this mission out, and I could just see the passion and no, beyond love. You're just at a different level. No, I love speaking to people that love doing, because ultimately you're just trying to help.
It is logical. But it's not about this. When you are saving lives,
no,
what can be more?
Nothing. I understand.
Reward.
I understand exactly what you say, and that's why I when I always talk about it, is like as a physician, what I came, and that guy, like I said, like I interviewed this neurosurgeon. He's talking about spirituality and all this stuff, and I see that. Ultimately, a lot of people, you get into your careers as physicians, and you're just you want to get expert in what you do, but then you start thinking, I came into this field because I want to help people. I want to be a healer. First,
Exactly.
We're healers, and then we're surgeons. But first, we're healers. Our job is to, when people come in, just say, hey, listen, I have made myself as educated on all these things so that I can direct people to begin their healing process. Because as you know, trauma, if somebody has a car accident and they have a spine fracture, the surgery is just one small part of the recovery from that trauma. That trauma, there's a million things they have to recover from. The emotional trauma, they have to recover potentially
Correct.
from an actual injury to their brain structure. They have to recover from just the physiological hit that the body has. There's a million things. We just focus on, okay, we put 4 screws in, we fix their spine, now it's nice and straight.
True.
And next. That's completely, that's not the way to think. So a couple more things. Wrap up, because a lot to digest here. So you guys were talking about earlier that you go into like trauma, like traumatized catastrophe areas, and you've done a lot of that. And you just guys go on the ground. So when people have traumas, and help me to, these are just concepts I just really I'm trying to understand. So if somebody has a trauma, are you looking to pick up part of how the brain is now, or whatever not the emotional brain or the actual brain, like are you trying to pick it up based on changes in their reflexes, or are you trying to change their reflex pattern to fix that problem, or both?
Both.
Okay.
And more.
And
beyond.
So how does that work? Let's say I'm a trauma victim.
No,
I hope not. I hope not. But I'd rather say it's
okay.
easier for me to say I'm a trauma victim than when that guy, like I don't want. I'd rather do my. But if I was a trauma victim and you saw me, let's say I was in the World Trade Center and I just barely got out. I escaped, but I have an injury and I'm not well, or I'm one of the firefighters that went through all that stuff and survived or whatever. Do you then, you do an entire assessment? I want to know how does it work from a clinical standpoint?
It is more parallel and holistic approach at the same time. So first thing, we need to know what we want to do. Generalized way, it is how we can support protection survival, the way that we will redirect the brain, not to manage the stress, but to regulate the stress. So just like holding, a lot of touch. So just like going
like
this
I told
way,
you before, I was like, whatever you need to do.
Going like this way, for example, you feel that I'm squeezing and I'm giving some light traction. I start giving the information about the importance. I say, here we are coming to lessen the stress. We want to regulate stress hormones and neurotransmitters. Sure, it will be depending on the language that is available. But many times, talking is not giving any kind of release.
No, touch.
Understand?
Touch is beautiful.
It is touch.
It's a beautiful thing.
So this is the work at this moment with hands grasp reflex pattern.
Does that affect my vagus nerve? What you're doing right now?
It will also do. But at this moment, I'm working with primitive hands grasp reflex pattern, because the hands grasp reflex pattern is giving strength to every spindle cell, Golgi tendon, all together to every muscle in the body. Just like you're bringing the strength into body instead of just like, I'm lost, I cannot do anything. just like bringing this information. And this is what gives also opening for the breathing. This is a reflex, hands grasp
Just by
reflex
doing
button.
that, you open
Just
up, because
with
I felt
this,
relaxed. I'm like, do it. I'm like, do it again. I'm feeling,
there.
I was tense. Now I'm
and
feeling
they
relaxed.
research on this, and then we can do several squeezes. Yeah. If person already just like is feeling the good touch, I would say 360 gram per centimeter square, depending now on diagnosis, or up to 550 for PTSD deeper, or 800s for cerebral palsy, quadriplegic, where really severe muscle contraction, for example. We even measure.
So you're talking about the amount of pressure that it's applied based on the condition that they have.
And when I'm touching, I can be there, but for pump, I cannot go down. I can go only up. This is the law of development of the direction of the skin and tactility. We go to this kind of details, but it is automatic in our hands. Yeah. So just like I will go, okay, sweetheart. It is important for us to move. You created for this world and come with very specific, your destiny task to overcome this. And when, like in Maui, the wild.
You went to the fire.
burn.
The fire was
Yes.
that was
Yes.
horrendous.
We worked basically several months.
Wow.
Our teams were going back and forth. We went last year. It was January, February. Only 4 specialists. Usually 8 or 9 specialists were going. We went 4 because of financial difficulties. Actually, for 4 days, 4 specialists. We gave over 100 sessions. But then we are looking also, allow me to look at some reflexes. And I'm going like this, hold strongly, squeeze.
Squeeze.
I'm pulling and then boom, and I'm looking if their brain is triggered or not for specific this secret kind of
So what happens if the brain is
activation
triggered?
of the flexors. Now, you responded, bravo, your brain was
So
doing
everything's
well.
I'm working, it's still working.
But it can happen that strong pressure,
Yeah.
person is not in their normal response, I would say, yeah. Or it is completely no any response, like we were working with combat. He was going with complete disconnect, like I was on the table and you cannot awake him easily. Lost 4 family members when he arrived from his
because they're almost
mission
they're
action.
almost disconnected.
Yeah.
They almost want to disconnect from their body.
And you need to awake, and just like where you will find everything is working. Your words, how you are talking, like you lost all your 5 or 4 family members, they all burnt. We understand all this. And here you
goodness.
are. Let's go together step by step. It is very much important for you now to awake, to follow us. And when it is disconnect and you think, okay, a person can be 2 hours or 12 hours in complete disconnect state.
Completely disconnected.
But
It almost.
it is, you are starting working with reflex fields and they come much faster. Then instead of 12 or 18 hours, you get them within 1 hour and a half.
Well,
Is this beautiful?
It is a beautiful thing.
And then they say, like, thank you. You redirected my mind
You brought
much
me
better,
back.
faster than I did or other methods. This is beautiful.
It's fascinating.
Sure. Next, we are working with reflexes. Hands grasp reflex button. Hands pulling. Hands supporting especially. You can imagine sometimes type of trauma is redirecting reflexes. This is amazing thing. Like when it is fire, it is just like this response instead of this. Give me your hands, please. Sorry.
There we go.
Okay, so here I am on the bottom of the palm and push straight ahead.
Okay.
Extend your elbows. Yay! Almost correct.
Almost. Almost.
kidding.
Was that like a B plus? Was that a B plus? Something?
We can
Okay,
say
we'll work
this
on
way.
it. We'll work on it.
So look, hands supporting reflex button, there. But when it is flat catastrophe, they go palms apart and hands are going to sides. We were solving this a lot, just like what is going on. So this is normal direction of a reflex, straight ahead in front of body. Flood catastrophe, survivors go there. instead of this. And then just like, okay, let's go with definition. This is aquatic reflex pattern. This is for ground. This is hand supporting reflex
Because
pattern.
you're trying to brace yourself.
But if you will go
from it.
this way in the water, you will be drowned. Brain is refusing own reflexes that can be not safe in the environment they are in stress. So it is amazing that reflexes that we think completely automatic, and they are according to situation and other things, but they have like variations not to act wrong way depending on the situation, environment, and other things. This is whole big secret that we do not know, how subconsciousness, unconsciousness, and our consciousness are really connected during the choice of this or that reflex.
Well, now we're going to get into the whole quantum realm and the quantum field, which I got into yesterday. So
it is something amazing.
Yeah, you guys were awesome. You know, thanks for joining us. I think, in just to summarize, I'm going to try to summarize a little bit. I think that what I'm getting is that the reflexes are almost a window into the brain. Not just into the brain, into the soul.
Dr. Svetlana told so.
Almost into the soul. So I'm going to have to pull out some textbooks, because I can tell you that reflexes were not high on my list of things, which you probably hear all the time. They're like, oh, I didn't think about that, which is why, conferences like this. This was really fascinating. I'm glad I got like a B+ on some of my Some of you said I did perfect, though. You said I was. You said they were correct or perfect.
Because we did some examples already before being here.
That's good. I feel good about my. Check with me after the gala tonight. Probably by 10 o'clock at night. Maybe the reflexes are not so good. Or whatever that means. But anyway, thank you so much, guys, for joining us. I learned so much. Literally, in this short time we spent together, I went from knowing nothing to knowing a lot. So. Thank you so much for talking to me. Thanks for coming on.
Wishes of health and success for you.
Thank you so much.
And let's
you guys as well.
Together for the development of AI technology to help people instead of doing things against of people.
Absolutely, and I'm not going to miss your talk next. Hopefully, I have time. I'll make time in my schedule to make sure I'm there. I didn't know. So, thanks, guys, for joining us. We'll see you on the next one.
Everyone.